Desert View Hospital is introducing this quality group of women's services from Women's Health Services of Southern Nevada. We're excited to introduce women's services to the community, and they provide, such quality care. This community has needed a number of physicians, and this is another service that Desert View Hospital is going to be introducing. They'll be beginning the first week of May. I'll let them talk a little bit about it, but the hospital just couldn't be more pleased to introduce this service to the community.
You talking?
Sure. Hi, I'm John Martin. I'm the president of Women's Health Associates of Southern Nevada. And as Kelly said, we are going to start the first week of May providing women's health services for the Pahrump Valley and Southern Nye County. And we're very excited about it. We're going to rotate. We're a group of 31 physicians in Las Vegas in 13 locations, and we're going to rotate probably between 8 to 10 physicians out here, initially once a week. And then we'll try to respond to the demand that the community has. We will provide office gynecology and obstetrical services, and then we will also provide surgical, minor surgical procedures and outpatient surgical procedures here with Desert View Hospital. We're contracted with most insurances, so shouldn't be a problem for most of the residents of the area, and we're just very excited about the opportunity. And I have Dr. Donna Miller, who's a colleague at Women's Health Associates of Southern Nevada, and then Dr. Sheldon Paul, and they're instrumental in helping us get this clinic established for our practice.
Do you guys know when the clinic, is it going to be a separate clinic, and when will it be built, if that's applicable?
Go ahead, Donna.
Oh, no. We're going to use the existing building here that's behind the hospital, and I think there is talk of a future office building that we'd probably be a part of.
Will you be coming out on specific days and possibly expanding if needed?
We're going to start on Tuesdays, and then we hope to expand at least to 2 or 3 days a week.
I think the plan at this point is to try to expand to 2 days fairly quickly, assuming that the services are there, the need is there, and then maybe from there down the road. But the idea is start with 1 and probably quickly get to 2.
Can you go into detail what types of services?
Full obstetric care, except for the delivery, of course. There's no delivery services out here, but the prenatal care, ultrasounds, hopefully fetal, and also fetal monitoring if indicated for higher risk patients instead of driving twice weekly to Las Vegas. Annual exams, pap smears with the hospital, all gynecologic imaging and mammograms in conjunction with them. Some in the office, some at the hospital. The minor surgical procedures we were talking about are tubal ligations, DNCs, diagnostics of uteruses and ovaries, and laparoscopy, which for pain and those types of things, and maybe some treatments for abnormal bleeding, and then of course pap smears and those kind of procedures that are usually done in the office for routine annual exams.
Can you tell us about Women's Health Associates of Southern Nevada themselves? Sure.
We have been in existence for 5 years, but really the last 3 years is where we kind of solidified as a group. What we are is a combination of practitioners in the Las Vegas Valley who actually had been practicing for many years, and we kind of saw the handwriting on the wall with the Affordable Care Act and all the changes in healthcare that the era of smaller offices is going away. But yet we didn't want to give up the close relationships you have in a small office, and so we found a model that we can be a large practice but still have each care center function independently, and where the patients don't lose that close relationship they have with their physician. So that's why we have 13 different offices. We merged these 13 practices into one practice. So we have all shared employees, we shared costs, and there's definitely some savings we've gotten from that. But the largest thing was to just kind of survive in the current changes in healthcare. And what was really neat is we realized we could provide services like this because we have such a large workforce of physicians. It would be hard for me individually to provide 2 or 3 days a week out here and still maintain my practice in Las Vegas. And I know that's what you've had. You've had some physicians who are trying to do that, and it's very difficult. Well, this is easy because we have 31 physicians potentially who could come out here and see patients. So we think it's one of those things that it was a secondary benefit of forming a large practice.
It was interesting because as we were forming that, it came up pretty early on as like, and we've worked with a couple of the free clinics along the way, Dr. Martin has, and we have a couple other projects in the works where when you have the manpower, you can provide, a lot of services to things you normally couldn't, and it doesn't put an overbearance of on one individual. It's because a lot of us have been here, I was born in Vegas, and that all the people around in all the outside communities have always had this lack. I have a lot of families up north, actually, family members in Moapa and Logandale, and they drive to town all the time. You just see those areas could really benefit from this kind of service.
Can you tell us just a little bit about how you decided which practices to kind of bring together to form the
Sure.
current practice?
Quality practices. I mean, we've all been in the community. We know who were the physicians that we wanted to work with. So that's how we kind of formed. We approached practices people that we would want to practice with.
Do you guys have specific specialties, each one of you?
No, that's a good question because obstetrics and gynecology is such a broad thing. There are subspecialists within obstetrics and gynecology who do additional training, like a GYN cancer specialist, they're called GYN oncologists, and the maternal fetal specialists who really specialize in high-risk pregnancies exclusively and reproductive endocrinology and fertility. Those are subspecialties, but every OBGYN is really trained. We can take care of high-risk pregnancies, we can take care of infertility, we can take care of cancers to a certain level. And so, it's a long answer to your question because we are capable of doing those things, but I think every physician kind of develops what they like, what their rhythm is, what procedures they like to do, what they don't like to do. And I think that's an important thing to admit as a physician. If you don't like doing something and you don't do it very often, you're probably not very good at it. So I think that, and that's just the truth, I think that we, again, part of our big group, there's a surgical procedure that I don't like to do. It's a very elaborate suspension of, I don't know if I can say vagina on your thing, but it's a very elaborate suspension of the vagina for women who have complete prolapse, where the vagina literally falls out after they have had a hysterectomy. And it's called a laparoscopic sacrocolpopexy. I don't like to do that surgery, but we have 3 surgeons in our practice who do it, so we refer within that to those surgeons. And so, you do develop, somebody has an affinity or a desire to do a procedure that you don't, then you refer within that practice. Somebody goes to a hospital that you have a patient, Donna has privileges over at Sienna and Henderson, I don't, but if I have a patient who wants to deliver it in Henderson, I'll send her over to Dr. Miller. So I think that's the long answer, but you do develop specialties within the specialty.
I'm sure that it depends on your insurance company, but would it normally be that a patient would have to go through their primary care physician to be referred to you, or would they just choose one of you?
Many insurances look at OBGYNs as the primary care providers. In fact, I think it's really the exception.
A few years ago, when in Vegas there was the malpractice crisis in state of Nevada, and especially in the Vegas area where we couldn't get malpractice insurance. One of the things that did happen, and it was when I was coming out of residency, so that's why I remember it, is there was a big push to make OBGYNs primary care specialists. Well, it didn't quite pan out like they would, but most insurance companies did follow I don't know if it was actually a law or a recommendation by the state that they be direct access as primary care for women. So most of our patients still have a primary care physician also. And
the Affordable Care Act does include that. I mean, that OBGYNs are designated as a primary care physician.
And how would a patient get to know, could you you said there's up to 31 possibilities of doctors coming out here. Get to know you guys individually, get to find out about the doctors.
Well, we want to be honest about how Pahrum's going to work. You won't get to know us individually unless you've known us from a previous patient or something like that. We'll have a designated schedule of who comes out here. But that's one of the things. If somebody wants their total care in Pahrump, it's very much going to be a team effort.
For OB. He's
For
talking
OB.
about OB.
Right.
GYN,
Right.
you can just schedule your annual exam. If you want to see, me or John or Sheldon, we'll know when we're going to be out here so they can call and get on that day that
Yeah.
we're here.